Today we'll unpack the kit. We'll start with an overview of survivorship and then move into a detailed discussion of the contents of the kit. In the 1970s, the overall survival rate for cancer was just under 50%. The term survivor was used to refer to those left behind after the patient died. But things have changed. The current survival rate has risen to 64%. Pediatric oncology has always led the way in enrollment on clinical trials. An estimated 90% of children under 5 diagnosed with cancer are treated on clinical trials, compared to only about 5% of adults. Because of this and the long-term survival data available as a result of diagnosis at an earlier age, pediatric oncology has yielded important information on the late and long-term effects of cancer and its treatment. Many larger cancer centers have pediatric survivorship clinics that provide structure to post-treatment care that is lacking in the adult survivor population. The number of survivors in the U.S. has grown from just over 3 million in 1971 to almost 14 million today. This graph shows the steady growth of survivors over the past 40 years. Close to 1 million survivors are added to the ranks annually. With improvements in the safety and efficacy of cancer treatments, this number will continue to grow. In 2006, the Institute of Medicine published their pivotal book, From Cancer Patient to Cancer Survivor, Lost in Transition. The committee documented the full impact of cancer and its treatment on the lives of survivors. This fallout from cancer crosses all domains of a person's quality of life, including the physical, psychosocial, and spiritual. These are just a few of the many issues survivors face in the years following a diagnosis. These are some of the core issues that should routinely be addressed in survivorship care. These issues cut across every domain of our lives, and until they are adequately managed, survivors will continue to feel off balance. The social challenges experienced by survivors are age-related. Young adults suffer more from disruption in their socialization, isolation from their peers, and problems with dating and relationships. Middle adults are focused on working and raising their families, so cancer can impact work, marriage, fertility, and sexuality. Older adults in retirement and on a fixed income may have to deal with limited resources and transportation problems. Betty Farrell and Marcia Grant have published extensively on quality of life in cancer patients. Quality of life is a multidimensional concept with physical, social, psychological, and spiritual domains. Cancer and its treatment impact patients and their families across all domains to create imbalance and distress. During treatment for cancer, we focus primarily on the physical well-being of patients without paying equal attention to the significant intrusion into the psychosocial spiritual domains. That only serves to exacerbate the imbalance. A quality survivorship program addresses the full range of issues created by the cancer experience and attempts to restore a sense of balance and well-being. The cancer control continuum has been used at least since the mid-1970s to describe the range of cancer services that begins with prevention and ends with hospice. If you have been in oncology for 15 to 20 years, you'll remember when hospice was a new concept and we struggled to educate patients and the medical community about its role in the cancer care continuum. Survivorship has now taken its rightful place in the continuum. Once you receive a diagnosis of cancer, you're considered to be a survivor. But the survivorship phase is geared toward meeting the needs of patients who have completed treatment and no longer have ready access to the system. It's an effort to bring structure and direction to life after cancer treatment. The kit was designed to be a model survivorship program for smaller community cancer centers. Formal survivorship programs are found almost exclusively at academic and larger cancer centers. Serving a different population of patients with a more limited budget, it's unlikely that these larger survivorship programs would easily translate to a smaller community cancer center. The Survivorship Program Kit contains a copy of the Institute of Medicine's video From Cancer Patient to Cancer Survivor, Lost in Transition, a brochure designed for survivors completing treatment, PowerPoint presentations and handouts to educate your staff, your administration, your patients, and your medical community. It contains a needs assessment that has a dual purpose to survey both long-time and new survivors and to serve as a distress assessment tool. templates to create a treatment summary, and a survivorship care plan. Everything you need to conduct classes for your new survivors. The kit contains an outline for putting together a series of 6 survivorship workshops, recommendations for setting up a cancer rehab program using existing resources, suggestions for building a survivorship library, printed survivorship materials available free of charge, and a list of online resources. Budget recommendations in a good, better, best format, a brief list of possible funding sources, an evaluation plan, which is useful if applying for grants to help fund your program, and several tools for primary care providers in your community. The video from the Institute of Medicine is a compelling portrayal of the many challenges of survivorship. It's about 17 minutes long and is a wonderful tool to open any presentation on survivorship, especially if the audience is not familiar with the concept. This brochure was developed as a brief education piece to encourage patients completing treatment and introduce survivorship as the next phase of treatment. It offers suggestions for healthy living to decrease the risk of recurrence. The digital files for the brochure are included to allow your marketing department to add your logo or make any changes you'd like to personalize it for your cancer center. 5 PowerPoint presentations are included to educate your staff, administration, medical community, and ideally, a group of survivors who would serve as an advisory board as you develop your program. The staff lectures are in 2 parts. We recommend you insert a photo of your cancer center building, staff, or patients on the title slide for all of these presentations. Consider starting this talk with the IOM video to set the stage. Part 1 provides an introduction, which is followed by the video. It then defines the problem of survivorship and talks about the care plan and the class, 2 key components of any survivorship program. It ends with a preview of Part 2. Part 2 picks up where Part 1 left off. It recaps what was covered in the first talk and then goes into late and long-term effects, psychosocial issues including employment and insurance, 2 of the biggest social issues. Nutrition and physical activity are discussed as the 2 most important areas survivors can modify to decrease the risk of recurrence and hasten recovery from treatment. It talks about the importance of advocating for our patients and then teaching them to advocate for themselves and others. And finally, it reviews a model of survivorship care for community cancer centers. Continuing the Care is a talk geared toward administrators to demonstrate the need for survivorship services and the required resources to create a successful program. All of these talks contain essentially the same information in formats that are geared toward a specific audience. Again, it's recommended that you begin with the IOM video. Sharing the Care is for primary care providers and oncologists who share responsibility for the follow-up care of survivors. While many of the topics are the same, the talk is framed in terms of the impact of survivorship care on the practices of the primary care provider and the oncologist. Issues and Answers is written for the survivor. It talks about the common problems that survivors face following treatment and offers suggestions for managing those issues. It also introduces the survivorship care plan, taking care of yourself as a survivor, and how survivors can help build a meaningful survivorship program. PowerPoints should be individualized to reflect your cancer center's identity and function. A script for each presentation is provided. Next is the needs assessment. Patients nearing completion of treatment can be asked to complete a needs assessment. Responses can serve as a baseline for follow-up assessment of recovery from toxicities of treatment. The tool can also be used before designing your program to help determine what services are needed and valued by your patients. You can survey all patients coming in for follow-up over a period of months to confirm the issues they face. Perlman Cancer Center did this and partnered with nursing faculty at Valdosta State University to analyze results and organize the information in useful reports. This tool can also serve as a distress assessment tool. The assessment is a 2-page document that asks patients to rate their level of distress caused by 50 issues that are divided into the domains of physical, social, psychological, spiritual, plus an other category. The patient's responses can then be incorporated into the Prescription for Life care plan, which we'll cover next. It also asks what topics patients are interested in learning about, which can be useful in developing educational workshops for your survivors. One of the recommendations of the IOM report was that all patients completing treatment should receive a survivorship care plan. There are a number of care plans available and under development. The Prescription for Life is a short format plan that has key information presented succinctly. In their 2012 Cancer Program Standards, the American College of Surgeons Commission on Cancer includes a provision of care plans to all patients completing the initial treatment. This document can help meet that standard. The care plan contains basic demographic information, significant past medical history, details of diagnosis and treatment, significant toxicities experienced while on treatment, recent disease assessment, the expected follow-up plan, contact information for all medical providers, a list of persistent and late effects of treatment, management guidelines if applicable, and recommendations for wellness and screening. The first page of the Prescription for Life covers demographics and the details of diagnosis, pathology, and treatment. It also contains the names and contact information for all providers. Next, information about implanted ports and the most recent CT or other results are recorded, followed by major toxicities experienced during treatment and any persistent effects that linger. This information comes from completion of the needs assessment or thorough patient interview. The expected follow-up schedule is noted along with the primary care physician's contact information. The care plan template contains a list of known late effects and the type of treatment associated with each of them. The person completing the care plan checks the effects applicable to the patient's treatment and eliminates any late effects not associated with the specific treatment received by the patient. The care plan finishes up with recommendations for screening, which can be adapted to reflect the practice preferences of individual oncologists. Wellness recommendations address optimal nutrition, physical activity, and risk avoidance. Here's an example of a completed care plan designed to be brief, one page, front and back. The brevity was based on feedback received from primary care physicians in our community. A succinct summary of pertinent details is more likely to be read than a long multi-page document. The care plan can be initiated when the patient comes for consult. As the patient progresses through treatment, the corresponding sections are completed. The treating oncologist reviews the completed care plan for accuracy and recommendations. When the patient comes in for the first post-treatment follow-up visit, the plan is reviewed with the patient. Information on psychosocial services can be provided separately to patients at this time. A copy of the care plan is given to the patient, one is sent to the primary care physician, and one goes in the medical record. If staffing is insufficient to create a care plan for every patient, an abbreviated document called a treatment summary can be completed. This summary consists of the first page of the care plan. The treatment summary omits important information on late effects and recommendations for wellness. This can be created on the Livestrong Care Plan website. Expected follow-up can be provided separately by the oncologist. The Livestrong Care Plan can be generated by Cancer Center staff, or directions can be given to survivors to create their own care plan. Information is entered from the treatment summary, and a plan is created that includes general information applicable to all survivors, regardless of diagnosis or treatment, plus detailed information related to the individual survivor's diagnosis and specific treatment received. It takes no more than 5 to 10 minutes to create a very comprehensive care plan. Journey Forward is an example of other available care plan templates designed for patients who have recently completed active treatment for cancer. It's available at www.journeyforward.org. If you have the staffing and physical facilities, a survivorship class can be a useful forum for delivering information to groups of patients as they complete treatment. The class consists of a survivorship video, PowerPoint, patient education handouts, and optional pre- and post-class questionnaires to assess the effectiveness of teaching. This is the title slide for the class PowerPoint. The information covered is very comprehensive and would ideally be presented by several disciplines, including social work, nursing, dietary, and chaplaincy. It's designed to be a 2-hour class with several breaks. Patients receive a notebook that's individualized for them. The notebook contains a survivorship care plan, a survivorship booklet or brochure, and patient education handouts on over 70 topics. The patient handouts discuss commonly reported survivorship issues. Each handout provides basic information, offers suggestions for managing the issues, and provides online resources for finding additional information. The handouts are color-coded according to the dimension of care they fall under. If patients don't have access to a computer, the Cancer Center should either provide access in a library setting or offer to print out materials from the web resources cited. Here's an example of one of the handouts on physical issues, social issues, psychological issues, spiritual issues, and other issues. A complete listing of handouts can be found on the last page of the brochure, Survivorship, because we owe it to our patients. A pre-class questionnaire is provided if you'd like a tool to measure the effectiveness of the class on several key healthy behaviors. For patients who give consent, a follow-up post-class questionnaire can be mailed to participants 1 year later. The questionnaire addresses use of alcohol and tobacco, weight, dietary and exercise habits, physical and emotional health, social and spiritual issues, and their perceptions about survivorship care. Some cancer centers may want to put on a series of workshops for their community survivors. It's a good way to not only provide important information, but to advertise that you're starting a survivorship program. Community experts are invited to present on topics of interest. Workshops are held monthly, and the final evening brings all the presenters together in an open forum. Attendees can ask any presenter a question about survivorship or related topics. The kit provides instructions for coordinating these events, suggested topics, and questions for the open forum if attendees do not have their own. Consider including your cancer center staff, MDs, nurses, social worker, dietitian, along with an attorney from the community and representatives from Social Security, mental health. The benefits of exercise in cancer patients has been well documented. Regular physical activity can have beneficial effects on fatigue, depression, anxiety, mood, sleep, stress, strength, confidence, osteoporosis, immune function, lymphedema, balance, flexibility, range of motion, and may decrease the risk of recurrence and improve survival in some cancers. Furthermore, it also reduces risks for cardiovascular disease. Getting patients to eat healthy and be more physically active is the most difficult task for any survivorship program, and yet it's the most important impact you can make on your patient's future. One suggestion is to start a cancer rehab program that uses existing cardiac rehab facilities. The staff is cross-trained to exercise cancer patients. We recommend getting your staff certified as cancer exercise specialists. Selected patients completing treatment can be offered a 12-week program consisting of 45-minute sessions twice a week. Participants should also regularly meet with a dietitian during the sessions. This pairs an expert on healthy eating with a patient who's focused on healing and becoming a healthy survivor. Taking advantage of this mindset can have an important impact on the decisions survivors make in this post-treatment period. The kit provides a description of the program, selected policies and forms, and several evaluation tools to monitor patients' progress. It also reviews several options for training rehab staff. Perlman Cancer Center worked with the physical education staff at Valdosta State University. One of their doctorally prepared exercise physiology faculty was also a nurse and was very instrumental in not only setting the program up, but helping to staff it part-time as well. The kit provides an annotated bibliography of a number of key survivorship publications. It's important to build a foundation of survivorship literature to provide support for current and future expansion of services. Each publication is pictured along with the title, authors, and publishers. A brief description of each book or journal is provided. A similar format is used to catalog online survivorship resources. The kit also includes budgets outlined in a good, better, best format to help cancer centers tailor survivorship services to their individual resources. There's a list of potential funding sources to help augment existing budgetary allowances. If you decide to apply for a grant, an evaluation plan such as the one included in the kit can be very helpful in demonstrating how you plan to assess the effectiveness of your program. The plan can be adapted to reflect the services your cancer center plans to offer. The final components of the kit are for primary care providers in the community. They include guidelines for adult cancer survivors, health problems in long-term survivors, and tables that detail both the chemotherapy and radiation long-term effects. These guidelines were developed by the American Cancer Society. On the left of the table, you'll see the pertinent statistics that show why these areas are important issues for survivors. This table takes each major cancer, highlights the major risk factors, and makes recommendations for both diet and physical activity to decrease risk. Investigators at MD Anderson Cancer Center in Houston profiled almost 6,000 cancer patients to document the most common health problems seen in survivors of the major cancers. You'll notice the same issues appear over and over, including cataracts, heart problems, arthritis, and osteoporosis. This table details the late effects of chemotherapy grouped by body system impacted. Late effects of radiation are grouped according to the body region receiving the radiation. These tables provide information about the likelihood of developing the late effect, most common presentation, and suggestions to monitor or follow early signs of a developing problem. Here's something to think about. We have an obligation to deliver cancer therapies, most of which are toxic. Do we have an equal responsibility to assist the patient to recover from our treatments? The answer, yes, we do. These are the goals of a survivorship program. We want to provide continuity of care and a similar structure to aftercare that patients experience during treatment. We need to bridge the gap between primary care physicians and oncology physicians, and the most important means of achieving that is by providing a treatment summary and care plan. Additional oncology resources can be developed and shared with primary care providers, and community workshops can be held for nursing and ancillary staff in primary care offices. We have to provide the resources to meet the needs of our survivors, the needs that come with both the disease and its treatment. How a cancer center chooses to meet these goals is flexible and dependent on resources and support from administrative and professional staff. There are several models of survivorship care. Cancer centers must adapt the model that best fits their setting and make it their own. This is a graphic depiction of one model of survivorship care. It was created by Mary McCabe, who runs a survivorship program at Memorial Sloan Kettering Cancer Center in New York. After treatment, survivors are transitioned to a nurse practitioner who functions independently in a disease-specific clinic. Most community cancer centers don't have the ability to implement this model, but with some creative shuffling of resources, it can be adapted for use in most clinics. Survivors can be scheduled into a class post-treatment that introduces the concept of survivorship, the issues that accompany this phase of care, and available resources to manage them. Candidates for cancer rehab can enter the 12-week program and receive counseling on nutrition and exercise. With a program in place to screen survivors and follow-up using a tool like the NCCN's Distress Thermometer, appropriate referrals and education can occur at each visit. If there's a nurse practitioner on staff, longer-term survivors could be scheduled to be seen and follow-up during specific clinic hours set aside for this purpose. This could occur on days that are typically less busy, for example, when oncologists schedule time off. These follow-up visits would target survivorship issues and include a visit with a social worker and dietitian. This is just one example of this model and how it might be adapted to fit within a community cancer center. We have the tools to begin offering survivorship services to our patients completing treatment. The key components to focus on include providing patients and primary care physicians with care plans or treatment summaries, survivorship education, delivery of psychosocial services, and counseling on nutrition and physical activity. It's time to play a major role in starting the healing process in our survivors because we owe it to our patients.